What is jaw contouring surgery? The lower jaw is a prominence that makes our lower face look good if it's in the right balance with other features of our face. Patients that have a jaw that's too protruding, too recessive, too long or too short are a little out of balance with the rest of their features. And what jaw contouring surgery does is it tries to balance all the facial features. What do we do when we do this? We can be either augmenting the chin, and that can be done with bony surgery or an implant, or even non-surgical things like injecting fillers. We can reduce the jaw, which can really only be done with surgery. And in the lateral jaw, we can augment that, or we can reduce it. We've got all those options. What we actually do is based on an individualized consultation with the individual patient, where we diagnose what they have and how we can best balance their face, and we make a decision on that. Is jawline surgery painful? Well, it depends, of course, on what we're doing. Certainly to augment the chin with a chin implant, that's not a particularly painful surgery. When I do bony surgery to augment, it's a little more painful and it takes a little longer to recover from it. What is jawline surgery recovery like? The recovery from jawline surgery, just like the pain, is based on what we're going to do. Specifically, if I'm going to do a drill down where I'm taking the chin down and making it more feminine, making it smaller because the chin is too big, I've got to deglove and dissect a lot of the chin muscles, and it takes a while for those muscles to function really well. Often patients look very good right after surgery, but when I talk to my patient that's had chin reduction surgery, they tell me that it takes a couple of months for their eating to feel like their former eating, for their smile and their movement and the way their face moves to be like it was before, and for their speech to be just as it was before. So some of these functional things, speech, animation, chewing, eating, are things that affect us, and often we can feel them. They don't feel quite normal to us 3 or 4 or 5 weeks after surgery. And I often have a long discussion with my patient. Chin implant surgery, people recover quickly. Bony surgery takes a little longer, but sometimes we have no option but to do bony surgery. How much does jaw contouring surgery cost? It depends entirely on what we're doing. If I'm going to reduce the whole chin and reduce the lateral jaw, I'm doing a facial feminization surgery, that could cost a lot. It may cost $9,000 or $10,000 to do all of the reduction that I might in the chin. If I'm just doing a chin implant, just augmenting the chin a little bit, that may be $4,000 or $4,500 for that alone. But as I get to bigger things, often I will do one of these things with a little bit of liposuction in the neck. So it depends on what the package is for that individual, and that requires an individualized consultation. I'd love to see you. I'd love to hear from you. If you have questions, call me, email me. I'd love to see you in my office, and thanks for watching.